Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kalazaar, also known as visceral leishmaniasis, is a serious parasitic disease affecting people worldwide. This disease thrives in tropical and subtropical regions, particularly in parts of Asia, Africa, South America, and Southern Europe. Travelers and individuals migrating from these regions can unknowingly carry the parasite, potentially spreading the disease to new areas. The key to combating Kalazaar lies in knowledge and awareness. By understanding the causes, symptoms, and prevention methods, we can empower ourselves and our communities to fight this global health challenge. Let's shed light on this often neglected disease and equip ourselves with the information needed to protect ourselves and those around us. Kalazaar is caused by a microscopic parasite called. It hitches a ride inside sandflies, small biting insects found in the tropical and subtropical regions. When the sandfly bites, it injects the parasite into your bloodstream. The parasite then travels throughout your body, eventually making its way to organs like the spleen, liver, and bone marrow. These organs are essential for a healthy immune system, which is your body's defense system against infections. Unfortunately, the parasite weakens the immune system, making it difficult for your body to fight off other infections. Kalazaar is often called a silent disease because its symptoms can take weeks or even months to appear after infection. One of the most common symptoms of Kalazaar is a prolonged fever, often lasting for several weeks. Unlike a typical fever, the fever associated with Kalazaar tends to linger, leaving the infected individual feeling weak and fatigued. Weight loss is another telltale sign, often accompanied by a loss of appetite and a general feeling of malaise. As the disease progresses, the spleen and liver may become enlarged. This enlargement can sometimes be felt by touch, particularly in the case of the spleen. Other symptoms can include anemia, leading to fatigue and shortness of breath. Additionally, individuals with Kalazaar may experience darkening of the skin, particularly in areas exposed to the sun. Experiencing any combination of these symptoms, especially after traveling to or living in an area where Kalazaar is prevalent, warrants immediate medical attention. Early detection is key diagnosis and treatment of Kalazaar. Diagnosing Kalazaar can be challenging, especially in its early stages when symptoms are often subtle. However, early detection is crucial for successful treatment and improving the chances of a full recovery. If you suspect you or someone you know might have Kalazaar, seeking medical attention promptly is paramount. Doctors utilize a combination of methods to diagnose Kalazaar accurately. One reliable technique involves taking a small sample of bone marrow, spleen tissue, or lymph node fluid and examining it under a microscope. This allows doctors to visually identify the presence of the parasite, confirming the diagnosis. In addition to microscopic examination, blood tests play a vital role in diagnosing Kalazaar. These tests detect specific antibodies produced by the body's immune system in response to the parasite. Once diagnosed, treatment for Kalazaar typically involves a course of anti-leishmanial medication. The choice of medication and the duration of treatment depend on various factors, including the severity of the infection and the overall health of the patient. In severe cases, hospitalization may be necessary to administer medication intravenously and provide supportive care. Protecting yourself and your community. Prevention and control of Kalazaar. Preventing Kalazaar requires a multi-pronged approach focusing on individual protective measures and community-wide efforts to control the sandfly population. One of the most effective ways to prevent Kalazaar is to avoid sandfly bites. These tiny insects are most active during dawn and dusk, so it's essential to take extra precautions during these times. Wearing long-sleeve shirts, long pants, and socks can help minimize exposed skin. Using insect repellents containing DEET on exposed skin and clothing adds an extra layer of protection. Eliminating potential breeding sites around homes and communities is crucial. This includes removing stagnant water from flower pots, gutters, and old tires. In areas where Kalazaar is endemic, using insecticide-treated bed nets provides a crucial barrier against bites while sleeping. Community-wide efforts to control sandfly populations are equally important, including insecticide spraying programs. Public awareness campaigns play a vital role in educating communities about the disease, its transmission, and preventive measures. Early diagnosis and treatment of Kalazaar are essential in preventing the spread of the disease. UMCC, your ultimate medical consultant connectors.